So, as you know, I'm here to talk about Beyondblue's really our grassroots level campaign that we've started. It's a national campaign. It's about taking one step. It's the simple catchphrase for the Beyondblue bus, the roadshow, I'll show you some videos about it. The bus is affectionately known as Rhonda at work. It's an 18-month program. The bus is travelling around 30,000 kilometres. We're holding over 200 physical events, as well as lots of online campaigns and things like that. The bus is going to, it's actually in Melbourne right now, but in a few weeks it'll be back in Sydney. It's been to tiny little towns. It's been to Darwin, it's been to Ayers Rock, it's been to Coopiti, it's been to the Kimberley. It's going everywhere in Australia. It's crisscrossing the country. And so that's what I'm here to talk about today, about how we want to work together and how we want to work together with you guys about it. Before I begin, I too would like to acknowledge the traditional owners of the land that we're on and pay my respects to the elders past and present. Oh, I forgot my name. I'm not even going to look because I know it'll change. Did it? So, take one step, the National Roadshow. Look, it's part of, we've been collaborating with, we're collaborating with all 61 Medicare locals, and who knows what that'll mean by the end of the roadshow tour, what that could mean. But we're working together with everybody, because, and as well as working with community stakeholders and lots of other services around this campaign. Part of it is about actually talking to the community about taking simple little opportunities to look after yourself. I think that sometimes we have really big programs and we talk about interventions, but also part of it is we can't lose sight of the small, powerful little conversations that can happen that can actually make a real difference. That actually can make a real difference to people in everyday situations. The themes for taking one step is we want people to look at their mental health by tuning in, opening up and taking action. Just jumping around here, but we want the community to actually create conversations around a whole lot of different things. So rather than me talking, I've got a video.
Beyondblue is hitting the road. We're travelling all the way around Australia until the middle of 2015. We'll be going to regional towns, outer suburban areas, right around this country to tell Australians about depression and anxiety, to help them recognise the symptoms and what to do to get help. Beyondblue plans to make a difference in this area in every part of this great country. We'll be asking Australians to take one step for better mental health. We'll be asking them to tune in on how they're feeling. We'll be asking them to open up, to talk about it, to have a conversation with people that you're worried about. We'll be asking everybody to join us, to join Beyondblue, to ensure that all Australians understand depression and anxiety, to increase awareness, to reduce the associated stigma, to help people ensure that they know how to make their mental health the best that it possibly can be. Beyondblue looks forward to meeting as many Australians as possible on the road with the Beyondblue Roadshow.
So it is about taking one step, and as Kate was talking about in that video, it's about doing simple little things. It's taking one step towards behaviour change, which improves people's mental health and their community's mental health. It's really about a community grassroots thing. It's about creating those conversations. It's that we're asking people to tune in and know what keeps them well and also understanding what situations put them at risk and being aware of those. to learn about depression and anxiety, and to look out for others in their community, to look out for friends, to look out for their neighbours, to look out for people in their community. It's about opening up and people sharing what's on their mind and starting a conversation, as Kate was talking about in that video, and understanding that that's a very courageous thing for somebody to be able to do, those little things, having a conversation, starting that initial conversation. I'm a big believer in technology because I'm working in a program that's going to be completely about technology. Maybe that's part of it. But also understanding that having conversations and taking steps and things like that, there's also these range of things that are happening in the technological space that we should be aware of as well. And I know that you were talking earlier about mindfulness, and there's a great mindfulness app out there. I think it's called Smiling Minds. And Smiling Minds has been developed. It's an app that's been developed, and it's an app that's for young people, it's for adults, it's for older people. So they trialled it. It's a program it was an app that was trialled for a while, and now it's been developed and tailored into simple ways. But it's a great app. I use it when I feel sort of overworked and overstressed at work. It's a great thing to just tune in for 10 minutes and pay attention to it, and get sort of centred again. We're also asking people to take action. So take action early if they recognise symptoms or signs, contact support services, find out what's in their community, work around things like that. Visit their GP, visit a mental health professional, find out what's going on, find out where they can get help and how they can get help. And also to join us though, because part of this thing is it's not about Beyondblue, it's not about services, it's about the community. So it's about the community recreating the conversation around these things. The biggest thing that still goes on in this day and age for people with mental health, around mental health, and with mental health difficulties and disorders is stigma. And in this day and age, it's a bit of a shame that we can openly talk about things like cancer and openly talk about a range of other things, but we can't openly talk about things like mental health. So it is it's a thing that we really need to work on and change. Because we know, and this is some of the stats, is around that stuff, is that lots of people, sorry I keep moving away from the microphone, no I'm not allowed to. The stats around mental health are really confronting when we think about them. Anxiety is the most common mental condition in Australia, and on average 1 in 4 people will experience anxiety, and that's 1 in 3 women and 1 in 5 men. In Australia, it's estimated that 45% of people will experience a mental health condition in their lifetime. So that's nearly a 1-to-1 ratio. Yet 65% of people who experience a mental health condition don't seek help or don't get the help they need. So imagine, again, if that was cancer and 65% of people couldn't get the help they needed because they were suffering a medical condition like cancer or something like that. There'd be an outrage in the community. And so that's why we want to sort of talk about changing the times, turning the tables a bit, creating these conversations, talking to people about taking the next step, joining in. According to the ABS data, 2,535 lives were lost to suicide in 2012. And for lots of places, that's double the road toll. Yet again, the road toll takes prominence. We don't talk about things that are happening in our community. So we need to think about that, because also out of that, though, is that 65,000 Australians each year attempt to take their life. So again, we need to think about those things. I want to mention here that, because part of this is about plugging things that Beyondblue does, in a sense, but because of what Beyondblue does is because we are not a service provider, we see ourselves as a disseminator of information. So we have dedicated suicide prevention advisors now that are looking at the things that we do and making sure that everything that we do is really up to date and really recognises how we need to implement and integrate suicide prevention and intervention strategies across all our initiatives. So as a starting point, we're developing information materials for people who have attempted to end their life, and information for a range of other groups, materials for Aboriginal and Torres Strait Islanders, for people with from the LGBTIQ communities, and a range of other things. This is about what Beyondblue is, because Beyondblue sees itself. Provide services from the cradle to the grave, in a sense, and a range of information services around that. We take a public health approach, and our aim is to improve the mental health of every person in Australia. That's our lofty goal, and we don't want to set ourselves a goal that's, that probably isn't achievable, some people would say, realists would say, but why not go for it in any way? Why not go after those lofty goals? We tailor our approaches when working with specific populations, as many of you would know, and we work in a range of settings including education, workplaces, health services. Online is a really big thing that we're growing into and thinking about that. And in general, our work is really about encouraging people to seek support. And so that's what our campaign is, take one step. Simple catchphrase to people, that's what our mantra is going to be. Take that step you need. So over 2 million people in Australia suffer from anxiety at any one time, and making it more common than depression. Yet again, it's one of those things that is downplayed. It's not there. It's not spoken about really openly in community. It's not understood well. So around that, to thinking about anxiety and the signs and symptoms, we designed a campaign, which I'm not sure if many of you have seen, or maybe some of you have seen, but I wanted to talk a little bit about it. We developed the first national anxiety awareness campaign, Get to Know Anxiety, in response to the research that we found out about this. The Get to Know Anxiety campaign was launched in May 2013, in early May. And the centrepiece of it was a short film by a very well-known Australian actor called Ben Mendelsohn, who actually came to Beyondblue and was really involved in creating it and said that he wanted to take part and do something. The video itself is on YouTube, and all of our promotional materials are online or on YouTube, or you can go to our website and order them. And it's had over 230,000 hits, and a lot of those hits through our analytics have been actually watching it through. And that was 230,000 hits between May 2013 and March 2014. So that's quite a good strike rate. In January 2014, Beyondblue launched advertisements to play on Channel 7 during the Australian Open in December, and audiences in selected cinemas saw what the campaign and the ad where it played, and they chose mainly to show it during The Hobbit. So I don't know what that says about people who are watching The Hobbit, that there's an anxiety campaign being played at the same time. But the other thing about it is it was a really big plug with social media as well. And I think that we need to understand the power of social media, the power in which we can communicate with people via social media. It's a place where people are spending a lot of time, particularly for, I can almost say this now, the younger generation, for young people and young adults. It's a space where they are, and our sector, the mental health sector or the health sector, the health sector is great at taking up technology. The mental health sector is terrible at it because we get afraid of it. So I think that's something we need to be aware of too, is social media, being aware of technology, thinking about how we use technology, thinking about the ways in which we do it. I was talking to some psychologists a few weeks ago now, and they do things like they use iPads to do assessments with their clients when their clients are at home. They do all these sorts of things, and they do all these things where they can actually share technology and information with their clients, so they're virtually working with them as well as physically working with them face to face. And the outcomes are really positive. So I will, rather than giving you some more stats, I'll play the video.
I've been expecting you. What? Don't tell me you don't recognize me. try and help you with that. I'm the ill ease that you feel when you walk into a crowded room. You know, the hot and cold flushes that confuse you when you're already confused enough. I am the one that raises the whip to your already racing heart. I am the tightening of your chest, the snowballing worries that feel like they might become an avalanche and can just bury you in an instant. My friend, I am the obsessive and I'm the compulsive. I'm the voice, you know, the one. It's always questioning everything you do, everything you think. And I am every single staring eye that watches you. And every one of those places that you try so desperately to avoid. So, now that we have become acquainted, what are you going to do about it?
The other thing about the anxiety campaign is that, and I will go back quickly, is that if you go to the website, I'm going to walk away because I want to point at the screen, is that there's actually stories from people who have come forward and created some stories about their personal experiences of anxiety and what it means to them and how it relates to them. So there's also a range of, with every campaign that we have, there's a range of different kinds of promotional materials, fact sheets, grab sheets, things like that, tips, all those sorts of things. So everything's freely available. We actually launched what I think is a really inspirational campaign this morning, for Beyondblue, and it's the Stop, Think, Respect campaign. And it's about casual racism, and it's about casual racism for Aboriginal and Torres Strait Islanders in across the country. And it's we know that from our research, and this is how it developed. It actually developed from research that we were doing and talking about casual racism, because it's a really important thing to talk about now. That Aboriginal and Torres Strait Islander people were saying it really affects their mental health as a community. The way that they experience racism in the country right now is really impacting on them. And that's those things that just happen all the time from people. And the video I was going to show you, but I'd say go to the website, because I know it's been on a lot of television stations today as well. Things like 1 in 5 Aboriginal and Torres Strait Islander people saying that they've experienced people who move away from them when they sit down. Simple little things like that. That the constant staring when they're walking into businesses, these things of mistrust. And it's a really important thing. I think that we're openly tackling forms of outrageous racism. Sometimes I think not in a good way, not as good as we could do it. But the next challenge is that casual racism, is to beat it out of our psyche of when people go, oh, but that's just the Australian way, just have a bit of a racist joke, or to do a bit of this or to do a bit of that. But, you know, we need to actually talk to the community about those sorts of things too, because the impacts of those on people is to the detriment of their mental health. So, yes, I would say check out the video and things like that. It was very good, and there's a great video of behind the scenes on there that's probably, I think, more powerful than the actual video campaign, and that's with the actors that were in the video and them telling you it was based on their experiences of how they've experienced casual racism in the community all the time. Children and young people. This is now, I'm in my common domain, I'm in my comfort zone now, so to talk about this. So we're moving on to that. We know that adolescence is a really important part of development. We know that a lot of the beginnings of a lot of mental health difficulties and challenges arise during adolescence. For those who are probably who work with young people, there's those catchphrases and those really powerful messages that 1 in 4 young people will experience mental health difficulties at any given time in a 12-month period. When you think about mental health and you think about health conditions and you think about young people, mental health for young people is their chronic disease. Mental health is the highest, creates the highest burden of disease for young people out of anything. Yet again, it's one of these things that we know that if we pick up mental health early and the development of mental health difficulties in childhood or adolescence, we can help to maybe not let them progress into adulthood or not be as significant. Yet we ignore it in some ways. We ignore quite a lot of it. Apart from, though, great organisations such as Headspace, which I think is, a really unique thing and a really unique program that we have in Australia, and we should be very proud of the way that we think about things in Australia. I know that mental health feels like a real challenge in Australia. I've done a bit of work overseas, but Australia is seen in the world as being very, very progressive. So I would say, we've got a long way to go in what we do. We've got a long way in equalising some of the funding for things like mental health, but we are doing some great work that's recognised worldwide as being some of the forefront runners in leading the development of new models. Youth Beyond Blue is a website. It's a website that has lots of information for young people. It was relaunched a few months ago. Youth Beyond Blue receives almost about between 500 and 600,000 hits a year from young people going there seeking information from professionals, from lots of different people, parents and things like that. It's really important. There's a lot of different information, obviously specifically tailored at young people. There's places in where they can reach out and find help. Parents can go there. But the other great thing too about Youth Beyond Blue that they've just done too is they've created an app called the Check-In app, which I'd ask you to check out as well. A Check-In app that was funded by crowdfunding, backed by Vodafone, and also we had some funky designers come in and who sat around on beanbags with people designing this app. But what it is, the Check-In app is actually about for young people, for them to look at it and think about, how do I create a conversation with a friend or somebody I'm concerned about? It gives them plan and strategies. They can go back in there, they can have their plan, and they can go back and visit that Check-In app and report in about how they thought it went. And the Check-In app will give them feedback about those strategies. So far, there's been thousands and thousands and thousands of downloads of the app. And the great thing about the app is that through our Google Analytics, we can look at it, is a lot of young people are actually downloading it, but progressing through and using it and reporting back at the end to themselves about how it went, what they could do, and where they can get more information. So once again, it's that thing about understanding technology and embracing technology. We do a lot of work in the educational space, and these are our programs in the educational space. So if we think about these programs, basically what we're doing at the moment with Beyond Blue is we have a range of programs that basically go from early childhood up to tertiary education. So KidsMatter and KidsMatter Early Childhood, which is in blue and green, you can see there is obviously our program for early childhood, to KidsMatter Primary, Sensibility, Mind Matters, and the Desk is our tertiary program, our program for tertiary students, for uni students. Uptakes of these programs has been really excellent, and we're exceeding all of the things we want to do, apart from Mind Matters because it's brand new, but our target is to work with 1,500 schools by the middle of 2016. We know that 1 in 7 school-aged children has experienced a mental health problem, and of these, only 1 in 4 receive help. 1 in 5 students experience mental health difficulties, but yet again, there's not much help out there for them. KidsMatter Primary is a component framework. It's not a set of lesson plans. It's a way of thinking. What we're trying to create for people, although there is lesson plans in it, but what we're trying to create for schools is this magical elixir that schools are looking for, going, here is a framework that actually can teach you about what a whole school approach is. Why work with schools and primary schools and secondary schools is the majority of kids and adolescents and teenagers and young people go to school. And getting in early is somewhere, and creating a school environment that they feel safe in, and an environment where they can learn lots of positive things is really important. So what we're trying to give to schools is a recipe of that, a magical thing of saying, now you know what you didn't know, and now you know why you want to go and choose that program, rather than, I just want to choose that program and do it, without knowing what the outcome of it is. At Headspace and other places where I've worked in mental health, is we used to get schools ringing up and they go, can you come to our school and give a 50-minute presentation to 500 students on anxiety? And we'd say no, because I don't know what the outcome of that is that you want from that. You know, we might as well just go and leave a pile of pamphlets on the front desk. You know, it's about saying to schools, if you want to deal with mental health, and because we know that positive mental health is really, really good for school achievement and outcome and all those sorts of things, think about why you're doing these things. So here's a framework for how you can approach that, which is what I'm doing. So it's the same thing for KidsMatter and Mind Matters, except that Mind Matters is moving into an online environment, which predominantly previously last year it was a face-to-face training program. It's designed to be chunk. We launched our first prototype of our first module, and the way that we've created Mind Matters is that somebody can go into Mind Matters and in 3 minutes they can learn something. That was our test. So somebody it'll be freely available to the public. Obviously it's geared at educational staff, but you can go into somewhere and in 3 minutes you'll be able to walk away and know something more about mental health, hopefully, that you didn't know before that. It's about taking the key messages of mental health and trying to turn them into, demystifying them in some way with people. So we really want to increase people's ability to tune in, open up and take action, okay, and really want people to understand that. So we're going to come and visit and work in conjunction with you and to create conversations within the community. So on the 8th of August we'll be at the City Technical College. I won't be there, but there'll be people from the bus there. But there'll be a whole lot of things going on. Our time with you and your region commences there. Our team minus the bus will be at Westfield in Hertzville. I've been told I've been getting names wrong all the time. So making sure I double check them. On Saturday the 9th at the shopping centre. And we're inviting people to come down and have a chat. There's a range of different things that we're going to be doing. So come along to the events, is what we're saying. Come along to the events, come along and have a chat, come along and be involved with people in the community. It's really interesting. I have been, the conversations and the things that happen on the bus, people just walking up going, what are you guys doing? We go, we're here to talk about mental health. And they enjoy it. The other thing about it is, I list some of these out the front. There's an envelope, and it says take one step on it. And in that envelope, if you write in that envelope, put the date on the envelope, put your address on the envelope, and write on the envelope what you're going to do to take one step to improve your mental health, and give it to me. We'll post it back to you in 12 months' time and see if you did it. So that's what we're going to do. That's part of our national campaign. Everybody is filling out these forms all over the thing, all over the place, all over Australia, all over the roadshow. I invite you to do it. I've only got a few because everyone stole them earlier today, but you can actually, in a week or so, go online and do it, and we'll send you an email back to you as well. But we'll post a letter back to you if you want to fill it out. And also there's lots of little things, but if you want any of the published material from Beyondblue, just get onto the website and we can arrange to send it out to you. Thanks.
Just some of the main mental health programs and services that the Medicare Local offers within the region. I'm just going to cover some of those in my presentation, and they include our ATAPS program, which is the acronym for Access to Allied Psychological Services. We also offer a mental health nurse incentive program, particularly in St George. We are the lead agency on the Partners in Recovery program, which launched about 12 months ago, and also the lead agency on 2 Headspace sites in the region. Okay, so ATAPS. Most of you are probably familiar with ATAPS and know that it's been around for quite a number of years now. The government introduced this initiative back in 2002 as part of the reform early in those stages. And the Department of Health, provides a clinical governance framework and some guidelines around how we operate. But primarily, the focus of the ATAPS program is to provide hard-to-reach communities with short-term intervention, and it includes some psychological intervention. And the hard-to-reach communities include those that are of low income, those from a CALD background, young people, Aboriginal and Torres Strait Islander communities, perinatal women and children, as well as we focus on suicide prevention. And ATAPS predominantly is focused on individual sessions, and it's short-term, as I mentioned before, 6 sessions with a review from the GP, and then a further 6 sessions are provided. We also provide some group programs as part of our ATAPS services, and we provide predominantly, sorry, I lost my train of thought. So basically short-term intervention. Okay. So what is the service delivery model that we operate here in the region? As I mentioned, ATAPS is a national initiative, and it's funded across the country to all Medicare locals. But what's unique about the program is that the government has given us some guidelines and ways to operate, but has given us flexibility to provide those services at a local level and target our programs to meet our local needs. So within our region, we have our model comprises 2 tiers, and the first one being for adolescents and young people. And we provide this model of care through 2 ways. We've got some directly employed clinicians that sit in particular in our Headspace centres and here at Cogra in our offices. And we also have a number of subcontractors that provide services across the region, and they're predominantly based in the Sutherland Shire. We also target at-risk groups, and this is our Tier 2 category. And under this category, we see people that are at risk of suicide or self-harm. We see children, we see young people that are at risk of homelessness, and we also see perinatal women and their families. And we provide this support again through a mixed model approach, or a hybrid model, where we directly employ as well as subcontract to the local health services. Okay. And I'll just cover who can refer. So predominantly when the program started, it was a program that focused on general practice and the GP developing a treatment plan. And that is the case for Tier 1, so the referral needs to come from the GP. And there is a review, like I mentioned before, where the GP just reviews where the client is at and ensures that the course of action is the most appropriate, and then I can ask for further sessions if that's warranted. And the reason that it's designed that way is obviously for ongoing care of the client, and also to build that approach that, to work in collaboration with general practice and to coordinate care. The other pathways that are available, and these have become more recently available, particularly for Tier 2 target groups, are that we can have some provisional referrals for some of our children's services, for suicide prevention and for perinatal programs. For more referral information, it is available on our website, and also available there are the GP treatment plans, the referral forms for ATAPS and the provisional referral forms. And they are completed and then sent through to the Medicare Local, where they're centrally triaged and assessed for the most appropriate services. Okay. Sorry, I didn't leave that before. It's also in your handout. Okay, I'll cover a little bit about our nurse incentive program. So the mental health nurse incentive program works a little bit differently to ATAPS as it's not a funded program but rather works under the incentive program. And if, as GPs are aware, it's funded through the same way that Medicare is. And this program has been around since November 2008, and we've actually had it in the region for about 4 years now, particularly in St George. And our program is the only one of its kind in the state where we have a shared care model, and we're in partnership with the local health district mental health services, where they employ the nurse and we are the organisation that supports the program and provides the linkages back to the GP. So the nurse incentive program works in collaboration with general practitioners to assist in the provision of coordinated care for people with severe and persistent mental illness. And the services include the monitoring of medication, improving patient links, and providing clinical care to these patients that are severely or persistently mentally ill. And the services are provided through a range of settings, including the GP practice, the patient's home, or even the mental health services. Okay. The next program that I want to talk to you all about is our Partners in Recovery program. And as I mentioned before, the South East Sydney Medicare Local is the lead agency on this initiative. Partners in Recovery is an initiative that aims to improve the system response and the outcomes for people with severe and persistent mental illness and complex needs. This program has been around, I think, since November 2012, so it was introduced, but only commenced in the region in November 2013, so that's when it became operational. Okay, so our Partners in Recovery coordinates with people and organisations from all sectors, including health, housing, income support, disability, employment, education, social services, and other supports that a person might need. And the way that it works is it coordinates local health, clinical, community, and social services. It builds partnerships between local services, community organisations, families and carers, and works towards improving pathways, as well as information networks. And another big focus of the initiative is to promote community-based recovery. So that initiative is one that is working in collaboration with a number of other support facilitator agencies. And what I should have mentioned is that the Medicare Local is a lead agency that is supporting the program, but the support facilitators and those working on the ground with the community and doing the care coordination are community-based services. And they include NEMI, St George Migrant Resource Centre and Benevolent Society, and they employ the support facilitators that are doing the work with the communities. And at the level of the Medicare Local, our role is to support these organisations to try and create system change and improve the sector response for people with severe and persistent mental illness. Okay. I'll go on now to talk about Headspace. And as was mentioned a bit earlier by Abby, we have opened 2 Headspace centres in our region this year, so it's really exciting. Headspace is, as you all know, is a centre and is designed to improve the mental and social wellbeing of young Australians through the provision of high-quality innovation services that are welcoming, friendly and supportive. And Headspace provides early intervention services and support the mental health and wellbeing of young people aged 12 to 25. And we offer a range of services within our Headspace centres, and that includes both mental and physical health, sexual health, drug and alcohol, information support, vocational and educational information support as well. Okay, so we currently have our two Headspace centres open, one at Hurstville in Dora Street. So if you know where the old division of general practice, St George division was, it's in that same location. And we have our Headspace Miranda site just opposite Westfields, Hurstville, near Fitness First, if you know where that is. And Hurstville has been open for just over 3 weeks now, and Miranda's coming up to about 4 months. They are both fantastic centres. We've got a full team of clinicians, we've got GPs, we've got youth access workers, we've got community engagement staff all working within the centre to support young people and the community. And what we also have is a number of consortium partners that are providing some outreach services in that one-stop shop for young people. And they include local services, mental health services, as well as employment education services, drug and alcohol, and a range of other supports that young people might need in that one-stop shop environment. And in terms of how to access the service, again, that can be done by self-referral, drop-in or a phone call, and we also have a referral form available on the websites, and I've just put up the numbers and direct website information if you'd like to access that. And I've just put up on there the mental health line that I made a mention of earlier. So for all of your inquiries around our mental health services and programs, or to access any of our programs, you can call the number on the screen, so it is the mental health number. Or you can visit our website, and we'll be happy to put you in the right direction. And all of our resources and pathways are also available there. And I'd just like to thank everyone for coming out tonight. Hopefully that was useful information for you all. Thank you.